Hi, my name is Chantel Lender. I'm an RN student, and today I'm going to be demonstrating peripheral vasculature and lymphatic assessment. So the first thing that we're going to do, we're going to do our introduction, which includes wipes, which is wash your hands, identify your patient by at least 2 means, provide for privacy, explain any interventions or procedures that will be performed, and ensure the safety of both the patient as well as the RN. After that, we're going to do our history gathering, which includes past medical history, family medical history, and current signs and symptoms. Then we perform our general survey. Then we obtain vitals. After our introduction is complete, then we're going to move on to the peripheral vasculature assessment. The first thing that we're going to do, we're going to inspect. We're going to inspect the extremities, so the upper and lower extremities. What we are looking for, we are looking to see if they are symmetrical. The upper and lower extremities are symmetrical. Next, we're going to be looking for color to see if color is appropriate for ethnicity. There's no ecchymosis or bruising. There's no redness. After that, we're going to look at the hair to see if it's evenly distributed. On the upper and lower extremities, the hair is evenly distributed. Next, we're going to look at nails. I'm going to have him bring his hands up and basically make a heart to see if there is a diamond shape between the nail beds. And if there is, that's a good sign. If there's not, then we would say that clubbing is noted, and clubbing can be a sign of extended hypoxia. So we're going to have you make a little heart with your fingers. Like that, and there is a diamond shape noted. So there's no clubbing noted at this time. We're going to look for any lesions on the upper and lower extremities. I'm not seeing any lesions on upper or lower extremities. Then we're going to assess for muscle bulk. We're going to look to see if we can see any atrophy or hypertrophy. I'm not seeing either on upper or lower extremities. And then we're going to assess for swelling. No swelling is noted in the upper or lower extremities at this time. After we do our inspection, we're going to palpate. Whenever we are palpating the upper and lower extremities, we are going to be looking for any temperature, any type of texture. We're going to check the turgor. We're going to assess capillary refill, and then we're also going to look for edema. So whenever we are palpating, I don't feel any type of temperature. There's no texture aside from just feels like regular skin. We're going to check the turgor of his hands, and that goes back immediately, so it is resilient. Then we're going to go down the lower extremities. And there's no temperature noted, there's no texture aside from skin. We're going to check the turgor, and the skin goes back right away. Then we're going to check capillary refill. That is basically whenever you take a digit and then you press down on the nail bed so that it blanches, and then you release, and then the blood should return in less than 3 seconds. If the blood returns in less than 3 seconds, then it's a brisk refill, which is a positive sign. If it is longer than 3 seconds, it's considered sluggish. So the capillary refill up top is both brisk. So then we're going to check the toes and see if that is also brisk, which it is. And I'm not noting any edema at this time of the upper or lower extremities. Next, we are going to assess the peripheral pulses. And there are 8 different places that we are going to assess those. And whenever we are assessing peripheral pulses, we are assessing for presence, symmetry, and strength. And they are either going to be present or not present. They're either going to be symmetrical, so they're going to be bilaterally on both sides, or the strength, you can rate them from 0 to 4. Plus 2 is regular and steady, which is where the majority of pulses are at. So the first area that we are going to palpate for pulses is going to be the temporal area. And they are present bilaterally, and I would rate them probably at about a +1. Next, we're going to palpate the carotid. They are present bilaterally, and I would rate them at about a +2. Next, we're going to do brachial. So I'm going to have you rotate your arm just a little bit. I'm going to feel here. It is present in the right extremity. I would rate it +2. Next, I'm going to check the left extremity. +2. And they are present in the left extremity, and I would rate them at a +2. So for the brachial, they are present bilaterally, +2. Next, we check radial. +2. And the radial pulses, they are present bilaterally, and I would rate them at +2. Then we would go for femoral. And they are present bilaterally. I would rate them +2. Then we would go to popliteal. and popliteal pulses are present in the right extremity, I would rate them at a +2. Foot flat on the ground, please. Thank you. And they are present in the left extremity, I would rate them at +2. Then you're going to go to the tibial, the posterior tibial, and they are present bilaterally, and I'd rate them at +2. And the last area that you're going to assess is the dorsalis pedis, and they are present bilaterally, and I would rate them at +2. So again, for the 8 different areas that you were palpating, you were rating for presence, symmetry, and strength. After that, you're going to palpate the radial pulse again. This time, whenever you're checking the radial pulse, you're looking for rate, rhythm, and strength. So for that, you can count for 30 seconds and then multiply by 2, and then that'll give you your radial. Okay, so I got a radial pulse of 35 in 30 seconds, so we're going to multiply that, and that would give us a radial pulse of 70. It is present bilaterally, and the rhythm is regular. So after you have palpated the radial pulse, we're going to identify the area. We're going to identify 2 areas that have lymph nodes in them. We're going to identify the epitrochlear lymph nodes, and then we're going to also identify the inguinal lymph nodes. So the epitrochlear, if you bring the arm this way, they are on the medial side just above the elbow, kind of near where the ACF is. I'm going to bring his other arm up so you can have a better view. But right above the elbow, so they're going to be right about here. So whenever I'm palpating here, I'm really not feeling anything, and I didn't feel anything on the other limb either. So that's the area where you can identify them at. The other is the inguinal. They are in the femoral triangle in the inguinal region. They're kind of down like right where your femoral artery, like right around that area would be. So I'm palpating there and I've identified the area and I'm not really feeling them. Okay. So after I've identified those 2 areas with the lymph nodes, then I'm going to take a listen to the temporal arteries and the carotid arteries. We're going to be listening for any bruits. The first thing that you want to do is you want to clean your scope. So go get an alcohol prep pad. Make sure that everything is nice and clean before it touches your patient. For this particular bruit that we are listening for, we want to make sure that we are using the bell of our scope. And we're going to take a listen for 15 seconds. So I'm going to get my watch ready. Okay, and while I'm hearing a pulsation, I am not hearing any bruits or any murmurs, so then I would listen on the other side. And I would listen again for the 15 seconds. And again, while I'm hearing pulsation, I am not hearing any murmurs or any bruits. Then I'm going to switch over to listening to the carotid. And while I'm hearing pulsation, I am not hearing any murmurs or any bruits. Okay, and again, I'm hearing pulsations, but I'm not hearing any murmurs or bruits. After that, we would obtain the apical heart rate. The way that we find that, you want to find the 5th intercostal space about mid-clavicular line. For the apical heart rate, you're going to listen for 60 seconds to obtain that. We would have obtained that before we came in for this assessment. I'm just going to map out, back just a little bit. I'm just going to map out that area, and then we already have that obtained. And it would be about in this region. Whenever you're obtaining the apical heart rate, you want to use the diaphragm of your scope. And again, you want to listen for 60 seconds or 1 minute to obtain it. But we have that previously, and I do believe that our apical heart rate was 74. Throughout this entire skill, I'm going to support the concept of infection control. Throughout this entire skill, I'm going to support the concept of patient safety. I'm also going to demonstrate proper body mechanics throughout the entire assessment. At this time, I am done with this skill. Thank you.